So we're here at the second annual APAPP conference, where I have to say the first conference last year brought 450 people. We have over 650 this year. So we hope to see you next year at the third conference. So this topic was chosen because it was expressed by a lot of our pulmonary colleagues as an area of confusion. So when it comes to lung transplant, we're just going to hit the high points and the key takeaways from our talk. So Caroline, do you want to briefly summarize some of your key takeaways?
Yeah. So I am, of course, talking about the pediatric portion of lung transplant, and something interesting and something that I think people would like to know is just the change in diagnoses and numbers of pediatric lung transplants that are taking place right now in the U.S. So with the introduction of the CFTR medications, there's been a steady decrease, luckily, in kids getting lung transplants. So we are still doing some, but that number has decreased. And then the number of transplants for kids with interstitial lung disease like surfactant disorders, genetic disorders, or pulmonary hypertension, those numbers are increased. So overall, luckily, actually, the numbers of pediatric lung transplants that kids are needing has gone down, mostly due to the CF numbers. But that's been a pretty drastic shift in our practice over the last 5 years.
That's a great point.
Yeah.
What about you, Sara?
Well, I am completely on the other end of the spectrum in terms of the age. During our presentation today, I'll be talking about patients 65 and older. So very different from the pediatric population. Overall, in the United States, not all lung transplant centers accept patients 65 and older. However, the data does show that there is a benefit with transplant. Yes, there are higher risks with, the older we get, the more comorbidities we have, the harder the medications are on us. But it has been shown that transplant can be right for the right 65-year-old, 73-year-old, for transplant.
Perfect. And I, of course, covered the 20 to 65-year-olds. And so I think the main thing for the prescribing pulmonary practitioner is drug interactions, and not just things we prescribe. Even though if you prescribe a fluconazole, that is totally going to take our immunosuppression meds through the roof and cause renal insufficiency. But you can't even give Advil, Aleve, any ibuprofen of any kind to a transplant patient. So I want you guys to remember that. And sort of our next point is we're always trying to balance infectious risk and the risk for rejection and how we go about balancing that. And I would say for me, it's involving my transplant pharmacist. What about you, Sara?
Definitely the transplant pharmacists and, the collaboration between the pulmonologists. It's very, very important.
Yeah. And Caroline, why don't you touch on, we have some emerging data on graft longevity, especially when it comes to pediatrics. Can you touch on a little bit of that emerging data?
Yeah, of course. Some of the things that I find interesting in the data that's out there, especially for pediatrics, is the difference in outcomes in infants versus children, which actually studies show right now that the long-term survival for infants and children is similar. It just doesn't feel that way. I anticipate that in the next decade or so, we find evidence that is showing that infant graft survival is longer, and that's just a practice feeling that I get. Maybe it's from the naive immune system, I don't know. But that's something that I see coming in the future is more studies on infant transplant, especially because that's something that's sort of relatively newer. Like the amount of infant transplants that we're doing is steadily increasing. So the more we do, the better we get. And just something that I find interesting.
Absolutely. And of course, all those transplants are dependent upon donor awareness. So as healthcare providers, all of us have to remember to encourage all of our patients and friends and families to be donors. Sara, you do a really good job. And I think our longevity depends on when patients are referred. And if they're referred late, it can be a harbinger of bad things. So can you tell us a little bit by each underlying disease, when's the best time to refer for fellow pulmonary nurse practitioners and PAs?
So for referring for IPF specifically, anytime patients are diagnosed, as well as like needing oxygen, even at with activity. IPF is such an unpredictable lung condition that you'd rather them get referred early. So that way, if there are other comorbidities, we can help manage and, support them in that. But when we actually do list patients, we do look at the trends of their PFTs. Do they have a 10% decline in 6 months? Have they developed pulmonary hypertension? We definitely want them to get as much mileage out of their lungs before transplant. So we'd rather have somebody be an early referral. For BOD of 5, that's when we want patients to be referred for with like COPD, for example, or if their FEV1 is less than 25 to 30%.
Perfect. And what about you, Caroline?
Well, it sounds like maybe it's the same in the adult and the pediatric world, that we would rather get a referral too early than too late. If it's too late, you sometimes can't even offer transplant at that point. But we always tell centers to just, if they're wondering, please refer to us, start the conversation. We'd love to stay in touch. And then part of that even is maybe we can help you co-manage, give you different ideas to help the native lungs stay in the child's body as long as possible to give them the most longevity that we can. But it sounds like that's the same for you too.
Yeah, it'd be the same for adults. And I just also have to put a plug out there for pulmonary rehab. I cannot speak how important it is for patients to have good muscular tone and strength as part of the recovery process. But then even before transplant, we don't want patients to be too weak that they're not a lung transplant candidate.
Absolutely. And in-person pulmonary rehab, I prefer because they get the social experience. But if a patient can't afford to go to in-person or they have transportation difficulties, any type of pulmonary rehab is certainly better than nothing, just getting them up and active. And then as far as the adults, the 20 to 65-year-olds, I would ask you guys to also please think about the comorbidities from osteoporosis to hypertension and diabetes. We're only going to make those things worse after transplant. So if you are referring, please go ahead and start addressing those as well as any vaccinations that you can think of. Because as you know, after transplant, the vaccinations don't work as well. And some live vaccinations we can't give. So I know that's a lot of information, but I just want to give everyone else a chance to, obviously we're here meeting with 650 fellow pulmonary PAs and NPs, and a long time ago there were so few of us. So can you guys give our listeners a compelling reason to come to the 2026 National Conference?
Oh, absolutely. I think the biggest thing that I think is that there's something for everybody. There's something for the pediatric person, the transplant person, the geriatric pulmonary lung nurse practitioner. There's something for everybody here. So every session I'm like, oh, there's something not for me. And then you find it. There is something for you every session.
That's very true. What about you, Sara?
I think networking and meeting other people in our practice. I mean, yes, pulmonary is such a wide range of specialties and definite interests, but you may meet people who practice in your same city that you're like, oh, I've gotten your referrals, or I've seen your name around, but it's finally nice to meet you. And I think that also helps foster those relationships so that when we have patients, we have mutual patients we can take care of together.
Mm-hmm. I agree. And I have to tell you, even though I don't do sleep or a lot of pulmonary hypertension anymore, I think they've done a great job of giving us some concise information on each thing so you can feel a little more up to date if it's been many years ago since you studied those things. So I would encourage you all to come.
It's been a great time.